Warning: 12 weird signs that show you're having colon cancer. Feeling off lately but can't pinpoint why? Strange yet subtle symptoms may indicate a serious health condition like colon cancer. In this video, we will cover 12 weird signs that can signify colon cancer, some less well known than others. Understanding these subtle clues can lead to early detection and better outcomes. Catching colon cancer early makes a huge difference, with survival rates up to 90% when detected in stage 1. Being aware of vague symptoms that could be warning signs allows you to get checked out sooner when they appear. Let's look at some of the signs of colon cancer. One of the signs to look out for is fingernail change. Fingernail changes may reflect nutritional status tied to colon function. Certain patterns like spoon-shaped indentations, convex shaping, horizontal white lines, pitting, or unexpected brittle crumbling can prompt us to check in. These reflect vitamins and minerals that are essential cofactors for nail health. As the colon impacts nutrient absorption when irritated, monitoring nails helps us assess supplementation needs. Sometimes skin health shifts too, signaling elimination status. Keeping amino acids, zinc, iron, and B vitamins optimal prevents depletion. Blood work, diet additions, probiotics, and stress reduction all empower us to rebuild. Support groups can inspire us too. Another sign is shortness of breath. Shortness of breath with unknown cause deserves evaluation to ensure lungs and circulation are working smoothly. Breathing oxygenates and clears our body efficiently when alignment allows. Since nerves, blood flow, and immunity influence each other, identifying root causes makes space for solutions. As we uncover core issues, remedies can range from colon care to circulatory tonics depending on the nexus. Anti-inflammatory foods, stress balancing, and lymph support often help too. Tracking patterns shows us the way forward. If breath or endurance gradually declines without infection explanation, seek collaborative expert guidance. Small changes ripple, transforming whole health. One sign to also look out for is a type 2 diabetes outbreak. A colon cancer may severely disrupt pancreatic function and hormone regulation, suddenly elevating blood glucose despite normal prior insulin sensitivity. The tumor cells trigger blockage-related inflammation that confuses the liver. How? By making it resist insulin signals even with adequate secretion from pancreatic beta cells. Plus, tumors bleed into the intestines, releasing proteins that further reduce insulin effectiveness and cause high blood sugar. If type 2 diabetes abruptly emerges in a previously healthy 50-plus adult without the typical gradual insulin resistance onset of metabolic syndrome, consider colon issues. For ladies, one sign to look out for is abnormal menstrual bleeding. Menstrual shifts in midlife can correlate with nutritional status and body harmony, warranting a holistic nurturing review. Fluctuating hormones communicate with growth factors and immune allies that can be supported. Heavy unusual bleeding creates fatigue if left unchecked as iron is depleted. Replenishment comes through identified supplementation and whole food choices. Underlying blood sugar imbalances or inflammation deserve caring attention via anti-inflammatory eating and stress balancing. Tracking patterns each cycle tells a story. Intuitive wisdom guides what our minds may miss. Healing is inside us. Wholeness is our birthright. An observable sign is an eye change. Blurry, double, or distorted vision accompanying yellow skin and eyes can indicate metastatic colon cancer impairing liver function. Jaundice arises when large hepatic tumor masses prevent adequate bile processing and drainage. Bilirubin and bile acids then accumulate to stain the skin and eyes yellowish. Severe liver dysfunction also allows toxins into circulation that irritate ocular tissues. Plus, retinal changes like spots, bleeding, and distortion manifest when cancer spreads to the eyes. Eye involvement tends to occur in late-stage colon cancer but demands rapid specialty evaluation to assess pathology and treatment options. Don't dismiss eye or liver area symptoms. Another sign to observe is changes in hair texture. Thinning, limp, excessively dry, or newly frizzy hair may reflect nutritional depletion from colon cancer deficit and malabsorption. It could be from bleeding or tumor metabolism. Chronic blood loss reduces iron and protein for hair growth. Poor vitamin intake and uptake also weaken follicle health. Zinc malnutrition alters structural proteins and boosts hair shedding. Rapid shifts in hair texture demand blood work to assess iron and nutrient status. Replacement can restore hair changes unless malignancy remains untreated. Evaluate the ongoing worsening of the hair condition combined with energy loss for the likelihood of colon cancer. Functional medicine practitioners uniquely recognize this cancer-nutrition hair link. Don't forget to take note of another sign: cough and congestion. A persistent cough or postnasal drip not clearly linked to a respiratory infection can manifest from colon lesions. The colon shares an extensive nerve supply with nasal and lung tissues. As tumors irritate intestinal nerves, this triggers reflex mucus production in connected passages. Excess mucus drips down the throat, and coughing results in attempts to clear it. Gradual cough worsening plus related congestion and runny nose needs evaluation to rule out stealthy colon cancer as the root trigger rather than assumed sinusitis or allergies. One other sign to look out for is the onset of lactose intolerance. If lifelong dairy enjoyment shifts suddenly to bloating, cramps, and diarrhea after milk products, a large colon tumor could be preventing proper lactose breakdown. Lactase enzymes in the small intestine fail to reach lactose sugars due to a complete downstream colon blockage. Undigested lactose is then fermented by gut bacteria to cause gas, pain, and loose stools. Sudden lactose intolerance appearing later in life without a gradual enzyme decrease from aging demands examination. Why? To determine if an obstructive mass prevents digestive access instead of assumed reduced production. Another sign you shouldn't forget to look out for is fever spikes. Intermittent, unexplained low or moderate grade fevers may reflect an immune response to colon cancer debris entering circulation. Advancing tumors frequently outgrow the blood supply and leak cells and toxins into surrounding tissues and vessels. The immune system launches temperature-elevating attacks against this cancerous material. Fevers come and go as tumor burden waxes and wanes, often worsening with growth spurts. Rule out clear infection before labeling these mysterious fever spikes idiopathic without considering colon cancer. Monitor for pattern changes indicating disease progression. A sign you should keep an eye out for is urinary changes. Straining, dribbling, or an urgent sense of bladder fullness with little output can come from an expanding colon tumor putting pressure on, or partially blocking, urine flow through the ureters or urethra. The colon rests adjacent to the bladder. As cancer cells divide and spread in the large intestine, they can gradually invade this space and alter bladder function. Tumors often advance silently and subtly before detection. Symptoms like urinary discomfort or retention are potentially dismissed as age-related prostate issues in men or incontinence in women. Scrutinize lower tract urinary shifts. A group of signs to look out for are breathlessness or dizziness. Easily winded, short of breath, or suddenly lightheaded suggests a lack of blood oxygen from iron deficiency anemia, often tied to chronic colon bleeding. Anemia reduces oxygen carrying capacity. Exertional dyspnea indicates cells are oxygen-starved. The heart strains to pump more blood to compensate, but it can't overcome the deficit. Gradually escalating breathlessness, weakness, and dizzy spells upon standing signal depletion from stealth internal bleeding rather than lung disease. Don't overlook the likelihood of colon cancer with these constitutional red flags. One more sign to look out for is rectal bleeding. Though most assume rectal bleeding appears red, darker or blackish stool represents partly digested blood from a right-sided colon tumor. Bacteria residing longer in the colon break hemoglobin from red blood cells down into black stool pigments. Notice foul, smelly stool as another bleeding clue. Traces of blood creating lighter brown stool also matter. All rectal bleeding deserves diagnosis, not assumed hemorrhoids. Bleeding accompanied by pencil-thin stools, diarrhea, constipation, abdominal pains, or anemia symptoms necessitates an immediate colonoscopy referral to determine the cause. Catching bleeding early boosts the prognosis. What are some of the things you can do to prevent colon cancer? the first thing you can do is run screen tests. Colonoscopies remain the gold standard for direct visual inspection of the entire colon, allowing tissue biopsy and polyp removal. Fecal immunochemical tests detect hidden blood and stool via antibodies. FIT doesn't require diet or medication restrictions. Cologuard examines stool DNA markers for cancer indicators. CT colonography uses abdominal CT scans to image colon abnormalities. Talk to your doctor about the best colon cancer screening options for your age, family history, and concerns. Regular screening enables the early detection and removal of precancerous polyps before malignancy develops. Another thing you can do is monitor your lifestyle choices. Take nutrient-dense anti-inflammatory diets high in fiber, fruits, vegetables, legumes, whole grains, and omegas while avoiding processed foods, excess alcohol, red meats, and sugars to reduce colon cancer risk and improve healing capacity. Vitamins D, B6, and folate support healthy cell function. Physical activity and maintaining a healthy body weight also lower the odds of colon cancer. Avoid tobacco, as ingredients promote mutations. Listen to body cues and address symptoms promptly for the best outcomes. Healthy lifestyle choices reduce carcinogen exposures, fuel optimal gene expression, and strengthen immune defenses against early abnormalities. What are the things you need to do to cure colon cancer? One important thing is to catch it early. Catching colon cancer onset in stage 1 when malignant polyps remain localized portends up to a 90% survival rate with prompt treatment interventions. Early detection guides surgery, medications, supplemental nutrition, and holistic modalities to support the body before extensive spreading. A tissue biopsy determines the cancer type and targets therapy precisely against the specific tumor characteristics present while preserving healthy function. Detecting a problem when restricted expands treatment options significantly compared to late discovery at stage 4 with metastasis elsewhere, when quality of life markedly declines during aggressive measures. Screening tests and recognizing subtle symptoms prove pivotal. Another remedy is to turn to medications. Oral chemotherapy agents like Stivarga, Lonsurf, Avastin, Erbitux, and Vectibix target cancer tumor characteristics and blood supply to disrupt growth signaling pathways. Immunotherapy stimulates the body's own immune defenses against malignant cells. These minimally invasive medications complement necessary surgery, nutrition, and radiation interventions. PET scans help match tumor markers and genetics to tailored pharmacological options for enhanced individual responses. Octreotide manages complications like diarrhea. Meds reduce recurrence risks and metastatic potential while bolstering patients during demanding treatments. Side effect management assistance proves key. One way to heal it is through radiation. External beam radiation focuses high-energy X-rays precisely on cancerous sites to directly demolish tumor DNA and proteins via ionization while exposing surrounding tissue to only scatter irradiation. This pinpointed delivery spares damage elsewhere versus whole-body exposure. Extracolon-directed radiation after surgery destroys lingering malignant cells. For advanced cancers, palliative radiation manages pain and bleeding from tissue invasions when removing or fully stopping growth is impossible. The key is matching radiation type and dosage to patient specifics for optimal destruction of growths with minimal toxicity. Side effects demand support. Another way to ensure healing is through improved nutrition. Consuming anti-inflammatory diets high in fruits, vegetables, legumes, nuts, seeds, whole grains, and omega fats while avoiding processed foods, saturated fats, excess protein, refined carbs, and sugars helps prevent and heal colon cancer. Vital nutrients like magnesium and zinc boost immunity against abnormal cell changes while promoting healthy tissue life cycles. Probiotic and prebiotic fiber supports beneficial gut flora harmony, improving absorption and reducing toxin exposures. Curcumin, green tea, and berry phytonutrients demonstrate anti-cancer benefits. Nutrition provides needed building blocks during demanding cancer treatments while cutting off growth promoters. Seek experienced nutrition therapy guidance. Conclusion: Recapping the main points, bizarre yet subtle symptoms may provide early clues about colon cancer, including finger and toenail changes, vision issues, breathlessness, congestion or coughs, and lactose intolerance onset later in life. Catching colon cancer in stage 1 when polyps are still premalignant or early tumors are still localized leads to up to a 90% cure rate and a better quality of life during treatment. Speak to your doctor about screening tests to detect signs early, and consider diet or lifestyle changes to reduce colon cancer risk, as prevention is powerful. Please like this video if you found it helpful, and subscribe for more content on hidden signs of cancer. Leave a comment with any questions or topics you would like covered in future videos. Together, we are winning health.